You know, when it comes to being treated by a physical therapist, most people think about, well, it's your arms, your legs, your knees, your feet, and everything. That's not necessarily true. There's a lot more to it than that. Well, today on the show, we're at Centric Physical Therapy, talking to Bobby Boyd, who is a physical therapist here. How are you?
I'm doing well. Thank you, Jim.
And there is a lot more to being a physical therapist and things that y'all treat out here than just those things. Y'all treat a wide selection of things.
We do traditional physical therapy, including knees and shoulders, those type of things. But we specialize here in inner ear problems. People who have vertigo, people who have dizziness, people who have imbalance issues. That's our focus. The inner ear is a wonderful thing. It communicates directly with your brainstem, and it kind of controls with the brain your balance. It also controls dizziness, and if you have vertigo, if you've ever had vertigo,
oh, I have.
A lot of people have. Yeah,
yes.
it can cause that. Positional vertigo is the leading cause of vertigo. It's the leading reason for somebody to say they're dizzy. And what happens there is these little particles, these little crystals that are inside this part of the inner ear break loose and they fall into these canals. They get in there and they need to be moved out back into where they're supposed to be. And that's a repositioning technique. It takes about 2 to 3 sessions if that's the cause of dizziness. Okay. The way we would determine that is we put goggles on you, which I'm going to show you in just a few minutes, and I have your eyes on the screen where I can see the movement of the eye, and that tells you which canal is affected by the crystals. So that's one of the treatments, that's one of the causes of vertigo and dizziness.
Wow.
Also, the nerves that come off the inner ear, now this is the acoustic nerve for your hearing, this is the vestibular nerve, like a vest you'd wear.
Right.
Talks to the brainstem. Each side has one, each ear. And what can happen sometimes is one can be weakened, and then what your brain does, your brain senses that, so it tells the other side to speed up. When that happens, you become imbalanced. That can lead to dizziness and vertigo also. And that's something we determine based upon specific testing and also based upon the eye test that we do with the goggles.
Wow.
There's also a third kind of cause of dizziness, and that's neck dizziness. Your neck can actually cause you to feel dizzy. Treatment for that would involve manual therapy, stretching, specific stretching to the upper cervical region,
right,
and also some of the vestibular therapy that we do. Now the vestibular therapy basically uses your brain to reset, realign your inner ear nerve firing, okay? That's what we do, that's how we do it.
That's amazing. I did not know there was so much that was involved with people that could have vertigo. Like I said, I've had it myself.
Right.
And it's a bad feeling.
It is. Quite a few people that I treat have gone to the ER because they're terrified.
I mean, you don't know. I mean, you get up and the whole world's spinning and you don't know what to do.
Exactly. Now, let me say this real quick. There's a difference between dizziness and vertigo. They do get used interchangeably, but vertigo by definition is an external movement. Like something is moving, the external world is moving. I have patients who tell me they'll lie back in bed and the ceiling fan's moving when it's not on. People get that when they lie back in bed and roll over in bed or sit up from lying down. Dizziness is an internal sensation. You feel it inside. That's the difference. It can be spinning, it can be floating, it can be rocking or waving. So that's the difference between the two.
All right. Well, let's go over here and show you how you do that with the goggles.
Let's do it.
Now tell us about these fancy goggles she has on.
Yes, Jim, these are video infrared goggles. They basically can show me her eyes in the dark or in the light, and I can detect improper eye movement with the test that we do. I do an oculomotor exam. I'm looking for any kind of inner ear nerve imbalance where one side is firing too quickly and one side is not firing fast enough. I can tell that by specific tests that I do. Also, we'll have her lie down. Let me have you lie down, Serena. Put your feet up. Just put your feet up there. And then I'm going to have you lie back with your head turned right. I can put her in positions like this where I'm looking for positional vertigo. So if she had positional vertigo, her eyes would be jumping and fluttering right now, kind of twisting, kind of rotating. And that would give her brain the perception that she is spinning, when truly she's not spinning, but it seems like she's spinning.
Wow.
So that's very helpful in diagnosing and determining what the problem is.
And what kind of treatment is he doing here?
Okay, Jim, so this is an example of static vestibular rehab, which basically is going to work her balance because she's on a soft surface. It's also going to work the canals inside the inner ear based upon her head movement. And then we've given her a task on the end to do where she's reading some colors, reading some words that are confusing to her brain, so it works the brain at the same time. Wow. And that's the whole process here. We're trying to get the brain to recognize there's an imbalance so it can correct it.
Okay. Now you got someone over here on a bungee cord.
Yes, okay, so we have what's called the solo step harness system that we utilize for patients that are really imbalanced or patients that are have significant vestibular deficits. It allows for confidence because they're not going to fall. They may dangle, they may hang, but they're not going to fall. It allows me to do things with them where they can turn suddenly, which is one of the biggest complaints we get. People have a dizziness with turning, or they have imbalance with turning. When they lose their balance, they even will fall.
Right.
So we can do those kind of things. We can walk eyes closed.
And I have had that before, where you do just a quick turn. I'm sure a lot of people have.
Exactly.
And they just like, oh,
Yep. And so a lot of vestibular patients will have issues with those type of movements, and we can put them on the harness, and I give them a good tether, and they're able to do 360s, 720s, and just kind of dance in this thing. And it allows them to do it. And it allows the brain, and we also will utilize the cognitive rehab, the vestibular rehab therapy for the brain at the same time, which allows the brain to work with the inner ear and the balance system to all work together at the same time.
Now, you were telling me about something they found recently with some other patients.
Yes. Okay. So vestibular rehab has been shown to be very effective in treating patients who have Parkinson's disease and patients who have diabetic peripheral neuropathy. Research from June of 18 last year showed a significant improvement, reduction in fall risk in those patient groups. So the vestibular rehab is effective to help prevent falls and also just to improve quality of life.
Now, it's just amazing all this. I did not know that they did this kind of thing. They specialize that here at Centric on Landon Road. By the way, it's on Landon Road in Gulfport, just west of Sam's Club, so you can't miss it. We have like about a minute left. So what are some of the other things real quick that y'all do?
What we do, like I said earlier, traditional physical therapy, we're going to shoulders and knees, backs, those type of things. A lot of patients I see that have dizziness, have vertigo, they also have neck pain. Anxiety, tension leads to neck pain. So we also stress. So we also treat that. And like I mentioned earlier, with the dizziness, it can be cervicogenic dizziness, cervical dizziness also. We can treat that, which is very helpful reducing those symptoms.
Well, I'd strongly recommend this, and I guess they need recommendations from
they would need
physician.
referrals. They need referrals for MD, a DO, from a nurse practitioner or a PA, physician's assistant.
Okay. So. Well, if you'd like some more information, you can go to their website. There's a lot of information on there. You can call and set up an appointment and get an evaluation of you. If you're dealing with inner ear problems, the dizziness or anything like that, give them a call here at Centric Physical Therapy, Landon Road in Gulfport.